Greetings and thanks for joining me today because I am going to talk about if your brain is stuck at a pain meeting. I'm going to explain what that means. My name is Dr. Jeanette DeWitt. I'm a doctor of physical therapy and a chronic pain specialist. And the reason I like to talk about the brain being stuck in a pain meeting is because that is what is happening if you are experiencing chronic pain. First, let's define what is chronic pain. Chronic pain is pain that persists for more than 12 weeks or 3 months. So if you've had an injury, if you've had nagging symptoms, and you are still experiencing pain and it's been at least 3 months, then you have chronic pain. What does that mean in the long term? Well, chronic pain is associated with a lot of other disorders. Meaning that if somebody has chronic pain for a long time, and trust me, I've seen people with chronic pain for 20 and 30 years. And what happens is if you're in pain, you often don't sleep well. If you're in pain, you don't want to move a lot. So what happens if you don't move a lot and you live a sedentary lifestyle? A lot of times weight gain sets in. And people then develop obesity-related diseases like high blood pressure, even some types of cancer, as well as some heart disease or even diabetes. So when we work together with chronic pain, I like to address all of those issues, but the number one issue is we have to get the brain out of the pain meeting. So what we do is we have your brain, and I'm just gonna put pain here, and that may show up on the reverse here with the drawing, so maybe we'll just look at that this way. And if your brain is stuck in a meeting, and if it's stuck in a pain meeting, it is not telling your body what it should do. What I mean by that is if your muscles are supposed to move in a certain way, but your brain is stuck in a pain meeting, then it's not giving the signals to tell your body to move the way you want it to. So a lot of times people with chronic pain says, I know what I want to do, but my body won't do it. Well, you're losing some of the synapses between the nerve and the muscle, what we call neuromuscular coordination or neuromuscular re-education is when we teach the brain to tell the nerves to give the muscles the signal to move the way your brain wants the body to move. But how does the brain get stuck in a pain meeting? Well, it's kind of like if you hit replay on a movie or on a song and you just play it over and over and over again. What is happening is your body keeps sending a signal to your brain to tell it that the body is hurting. And the brain keeps receiving the signal and says, I hurt, I hurt, I hurt. And it's constantly on replay. So you have this never-ending cycle. And what we have to do is we have to break the cycle and intervene. We have to intervene to break the cycle of pain so that the brain can start to remember what it feels like not to have pain. And you may be thinking, especially if you've had pain for more than 3 months or you've had pain for a few years, you might be thinking, I don't even remember the last time I experienced a day without pain. Exactly, that is exactly my point because the brain is stuck in the pain meeting. Now, this is not just my theory. This theory has been proven by Adrian Louis. I took some continuing education courses from him, and he is an expert in basically neuro re-education. And what he shows is that when the body is hurting and people just think it's all in their head, they kind of lose some hope. And when they think that maybe I'm just imagining this, maybe it doesn't exist, they think that they are going to have pain for a long period of time. A very simple thing of teaching people that pain is in their head, but it's actually real. They're not making it up. They looked at functional MRIs. 15 minutes after somebody was shown how to get pain out of the pain meeting, and without even moving, the person's pain symptoms went down. I believe that that is because they recognize that their pain is real, so their pain was validated. The other thing that I believe is that once they knew that their pain was real and that something could be done about it, the stress level reduced. And when the stress level reduced around pain, they realized that they could have hope in getting the pain to stop. Now here's an example. If somebody sprains their ankle and they're crossing the street, they actually are not going to feel their ankle if a bus is coming. Now what do I mean by that? If their brain registers the bus, they may be hobbling across the street, but that bus takes precedence. So in that split moment, they don't have pain in their ankle because their brain is on high alert. I got to get my body out of the street so that I don't get hit by the bus. Now when they get back over and they've crossed the street and they're on the sidewalk, their ankle will start hurting again. And the reason is because the emergency is gone. And their ankle pain is now the thing that is taking precedence. I also like to use the example that if you bump your leg on a coffee table, you are trying to get somewhere else, so you're like, oh, I bumped my leg, and you move on because something else is taking precedence, so you dismiss that little pain that you had by hitting your leg on the coffee table. But the next day, you're like, how did I get that bruise there? You got the bruise there because you hit your leg on the coffee table and it caused tissue trauma. If you press on it, you are going to feel the pain. But you may not feel the pain anymore because it didn't take precedence. My point here is that you can have tissue trauma and no pain. But you can also have completely healed tissue and still have pain because your pain is stuck in a pain meeting. And that is where we have to break that cycle of pain and pain and pain. The way we do that, or the way I like to do it, is I like to go through a 7-step process. And in that 7-step process, I teach people how to use specific movements to get their pain gone. And I've had people reduce their pain from a 70 or an 80 out of 100, with 100 being emergency room. So 70, 80, that's like high alert. That's a lot of pain. They're limping, they might be carrying their arm and not wanting to use their arm very much if it's an upper body injury or they're in upper body pain. Anyway, I've had people in high alert pain, ready to go to the urgent care. And I've taken them to 10 to 20 out of 100 pain. Sometimes I've even taken them to 0 within 30 minutes. But 95% of the time, I get people down to by 30% or reduce their symptoms by 30% in 30 minutes. And how do I do that? Using this 7-step process to interrupt the pain cycle through movement, and it brings the brain out of the pain meeting. By using movement, I like to say I use movement as medicine. By using movement to get the pain out of the pain meeting and get the brain out of the pain meeting, I have the brain focus on something else that takes more precedence. And I'm using pain relieving movements to do that. Because there's a misnomer that some people, I don't want to exercise because it'll cause more pain. I would argue that being sedentary and not moving is actually going to cause you more pain than if you moved in pain relieving positions. So I teach a 7-step process that teaches people how to use movement, specifically pain-free movements, to fix the painful movements and bring the brain out of the pain meeting. When I do that, their symptoms, 95% of the time, reduce by 30% within 30 to 45 minutes. And when people keep repeating this process, then they're more likely to reduce their symptoms by 30 to 50% within 5 days. And if they keep repeating it, they're more likely to reduce their symptoms after 4 weeks, often to nothing, even if they've had pain for 30 years. I've seen it happen. And the coolest thing about that is if they were to go to a healthcare provider, even if it was a chiropractor, a traditional physical therapist, because I'm a physical therapist, I don't treat in that way anymore, but if they would have come to me and they did this type of treatment only 2 times a week coming to physical therapy, and they do that for 4 weeks, that's only 8 opportunities to get relief. But when my clients go through a 5-day process and then repeat that 3 more times to get 4 weeks, and they're doing 20 to 30 minutes twice a day of pain relieving movements, they have 56 opportunities to feel better. Because they've, instead of taking their brain out of the pain meeting 8 times in 4 weeks, they've taken their brain out of the pain meeting 56 times in 4 weeks. It's the coolest thing to see, and more importantly, it's the coolest thing to experience. Because when that pain goes down and the brain is able to get out of the pain meeting, it's able to tell the body how to move. And when the body can move in pain-free movements, we slash the pain cycle. And the brain comes out of the pain meeting, and it's more likely to stay out of the pain meeting because of repetitive pain-free movements. If you want to learn more about that, go ahead and private message me or comment in the feed below me, and I will personally reach out to you. But it is super important. If your brain has been stuck in a pain meeting for more than 3 months, the sooner you get it out of the pain meeting, the sooner you're going to start feeling better, and you're going to be able to start living your life instead of missing out on things that you want to do. I hope you find this informative. Like I said, if you want to get out of the pain meeting and back into living your life, go ahead and comment me or private message me. Thanks a lot.